The majority of the tests for recurrent early pregnancy loss are not invasive. They involve blood tests, ultrasounds, and sometimes a sperm test for the male partner. We do sometimes order an endometrial biopsy, which is probably the most invasive test we do, but again, it's done in the hands of experienced gynecologists, so it's fairly routine at our clinic to order that. Once we gather all of the information, we then can decide what further investigations are needed. And typically we look at areas such as genetics, so the parental genetic information or karyotypes. We look at, as I mentioned, structural factors, looking at things that they could have from birth, such as changes in the structure and shape of the uterus, or things that we can acquire, like polyps or fibroids. So it's important to get an imaging study of the uterus. We look at hormonal factors. The thyroid function is important, as well as another hormone called prolactin. We also sometimes screen for infective issues, such as a condition called chronic endometritis that can sometimes come with previous losses or previous instrumentation of the uterus. We screen for autoimmune concerns. That's an area of expertise of Dr. Laskin. Things like antiphospholipid syndrome. And we also are beginning to look at the input of male factor, things such as DNA fragmentation and other male factor historical problems or lifestyle issues that are relevant.